Hi, you guys. Welcome back for our daily practice questions. It is day 170 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description that takes you directly to all of the resources that I offer for first-time test takers as well as those who are retesting. All right, you guys, question number 1. A 16-year-old presents with open and closed comedones on the forehead and chin, but no inflammatory lesions. What is the most appropriate first-line treatment? Is it A, oral doxy? Is it B, topical benzoyl peroxide and or topical retinoid? Is it C, oral isoretinoin? Or is it D, oral contraceptive pills? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate first-line treatment? And y'all know I always tell y'all, if they're looking for a treatment, you need to run it back and look and see if they provided you with a diagnosis. If they have not, then you got to run it back a step further and look at those assessment findings so that you can determine what it is to be able to treat it. All right, so here we don't have a diagnosis. So looking at the assessment, it states that we have a 16-year-old that comes in and they have open and closed comedones on the forehead and chin, but no inflammatory lesions. So this is like a mild case of acne. We have comedones, but nothing inflammatory, right? So your best treatment option is B, just doing topical agents, topical benzoyl and topical retinoid to help with those comedones, okay? Question number 2. An 18-year-old presents with papules and pustules on the face and upper back that have not responded to over-the-counter products. What is the next best step in management? Is it A, to start oral isoretinoin, B, to initiate topical metronidazole, C, prescribe oral doxy plus a topical retinoid, or D, use topical nystatin and corticosteroids? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the next best step in management? All right, so this is still a treatment style question, so I don't see a diagnosis here, right? So we're going to look at the assessment findings. So it's an 18-year-old, they come in, they have papules and pustules on the face and upper back, and it hasn't responded to over-the-counter products. So still, this is acne, but this is more of a moderate stage versus like question number 1 where it was mild. And how can you determine that, right? So with mild acne, just like we were just talking about, they have comedones that are non-inflammatory. So think about your blackheads and your whiteheads. Those are your comedones, right? Whereas papules and pustules are now inflamed. Remember your terminology when I tell y'all the derm terms. Go check out my dermatology video if you struggle with these. But derm terms, remember your papules are that reddened bump. It's inflamed. Now the comedone, the whitehead, the blackhead is inflamed, right? And pustules is now filled with pus. The papules are now filled with pus. So now they're pustules, right? So we need a little bit more than just a standard topical agent. So your best answer is C. You want to prescribe like an oral tetracycline like doxy, and then add a topical retinoid, so a topical agent as well. All right, lastly, in question number 3, a 20-year-old male presents with deep painful nodules and cysts on his face, chest, and back. He has scarring and no improvement with previous oral antibiotics. What is the most appropriate next step? Is it A, to increase the dose of doxy, B, add topical clindamycin, C, refer for oral isoretinoin therapy, or D, begin oral corticosteroids? Take a moment and tell me what you got. All right, so stem of the question here, what is the most appropriate next step? All right, so let's see if we have a diagnosis, and we do not. So we have a 20-year-old male, comes in, has deep, painful nodules and cysts on his face, chest, and back. He has scarring and no improvement with previous oral antibiotics. So, okay, y'all, you can see this is continuing to be progressive, right? So this patient has a more severe stage. This is more of the cystic acne. And remember, with cystic acne, we're going to treat with things like Accutane, right? So C, you're going to refer them out for oral isoretinoin therapy, aka Accutane, for management. And remember, we do not give this to pregnant women, right? But C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. This was day 8 of our Derm series, Derm portion, I should say, of our Pharm series. But continue to follow along. I'm going to take you through all of the systems as we navigate how to treat and how to approach treatment style questions on boards and to prepare for practice. All right. But y'all make sure y'all subscribe so you don't miss any of my videos. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And again, my website is also linked in the description. And this houses all of the resources that I do offer. And as I always say, it's broken down for first-time test takers or if you're retesting, so you know what will help you the most. Because I get that question often, so I divided this up to kind of help you as you navigate. But all right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.